today we are talking about arthritis, as fun as that is.
Oh, yeah, it's just, there you go.
Alright, so, unfortunately, most older pets are the ones that end up with arthritis. And a lot of times it's because they're slowing down. They don't exercise as much, they lay around more, things like that. Their joints aren't moving around, getting that good lubrication. Also, unfortunately, 30% of adult dogs and cats are typically affected by arthritis. And sometimes, if it's in a younger animal rather than the older animals, it can be due to an injury such as a torn ligament in the knee or something of that capacity. Okay. So, the main types that we kind of cluster everything into are osteoarthritis and rheumatoid arthritis. Osteo just means bone, so anything arthritis related specifically to bones, joints, things like that. Rheumatoid arthritis, it's related to an immune-mediated disease. So, osteoarthritis. It is the most common cause of lameness in dogs. It's typically non-infectious. There are times where it can be infectious, but most of the time it's not infectious. It can be chronic, and it can be progressive. So, once it starts, the more it rubs, the more arthritis we'll get. And a lot of times, instability of those joints, so being overweight, torn ligaments, things like that, can cause it, and any kind of trauma as well as the aging that we already talked about. So, rheumatoid arthritis is destructions of the joints themselves. So rather than it being mostly the bone and little bone spurs, it's actually the joint capsule and things like that that is diseased. And like I said before, it's immune mediated, so it's actually the immune system of the animal attacking the joints of the body. So, some clinical signs and symptoms in dogs: lameness, limping around, things like that, swollen joints. There can be times where you look at a joint and it looks swollen, but you push on it and it still feels hard. That's kind of what we're talking about here. Bending the joints, it kind of sounds like you're pushing on some bubble wrap as you bend it. We call it crepitus, but it's popping and cracking of the joints. Muscle wasting, so because it hurts to get up and down, they don't do it as much, so they're not using those muscles, so they deteriorate. Licking of the joint areas, it's, sometimes painful. Licking is kind of how the animals go about relieving or making themselves feel better by licking the joints themselves. Having trouble getting up when they're laying down or sitting. If they stop eating because they're painful, and they can actually gain weight as well because they're not moving around as much as they should be. They don't want to go for the walks as much. They don't jump as much as they used to. Climbing stairs becomes more of a chore than just, oh, let's go to bed kind of thing. Certain times, depending where the arthritis is, if it's in the spine, actually posturing to go to the bathroom like they normally would becomes painful. So rather than posturing or things like that, they try to hold it longer and then they start to have accidents, or rather than doing the posturing, they'll urinate just laying down because it's more comfortable for them. Touching the joints, anything like that, they can whine, pant, whimper when touched and everything. Okay. So there are a couple of types here. So they can be caused by tick-borne disease such as Lyme's disease, the immune-mediated, the rheumatoid arthritis like we talked about, trauma, if they got kicked or hit by a car, anything like that, or a ligament, things of that nature, or metabolic issues, and then we go back to the osteoarthritis. A lot of times the main portion of it is that the cartilage in the joint, there's the bone and then the cartilage on the top, and the cartilage squishes when they walk. It takes the brunt of the force, and over time as they move and everything rubs and squishes, the cartilage wears away so that it's getting thinner, there's not as much lubrication, and then the bones start rubbing on each other rather than having that cartilage cushion in there. So one of the main types we see is hip dysplasia. It can be in any dogs, older dogs, or it can be in the younger dogs depending on the breed. A lot of shepherds and rottweilers and things like that, we see a lot of hip dysplasia. The hip socket is what we call a ball and socket joint. So there's the cup and the hip joint goes in it and it roams around and moves around, and that's how we wear down the cartilage on the end of that bone there. If it's malformed, which is why we see it in the German shepherds and the rottweilers, the cartilage wear down more quickly, giving them the hip dysplasia at an earlier age, the arthritis at an earlier age. That's why if you're feeding a dog a breeder, that's why try to find one that has the hip certified. So there's a program called OFA, Orthopedic Foundation for Animals. You can actually have eyes, elbows, hips, and I believe hearts nowadays certified, saying that there's no congenital disease or anything like that that's going to cause a problem later in life, such as hip dysplasia or an enlarged heart, problems with the eyes, things like that. Alright, so here's a lovely picture of a normal side versus a dysplastic side. So this is a hip joint here. So this is the cup and this is the ball in there. It fits in very nicely. It's where it's supposed to be. It's rolling around the way it should. It's not rubbing on anything. This is the dysplastic hip. So you can see how much further out of the cup that the wrong part is. So every time it moves, this part is rubbing on the edge of that hip bone, wearing down the cartilage, causing the discomfort, the pain, the swelling, and the wearing down of the cartilage there. That's a good picture.
I liked how to the side by side.
I like it. Okay, so that brings us to the elbows. Again, certain breeds are more common to have these things done. It's unfortunately usually the larger breeds, which is why we always recommend getting a puppy from someone that the parents have the elbow certified. Unfortunately, with elbow disease, it's not always just the wearing down of the cartilage. Sometimes, depending on the way it rubs, you can actually have chips of the bone floating around in there, getting lodged, causing problems, rubbing on things. It's decently painful. It can happen in a younger age, older age, and there's multiple different types. Unfortunately, the elbow joint, rather than being a ball and socket joint, it is more of a hinge. So, but it still has that rounded cup in there. So if you break off this part of the cup, then it's still floating around in there, getting lodged in as it's bending and things like that. So it does become pretty painful for them. And then we go to the knees. So luxating patellas is something that we very, very commonly see in the smaller breed dogs. What ends up happening is as they grow, their femur and their tibia aren't lined up the way they should be, so their kneecap pops in and out. It rubs on the cartilage of that joint there, and they will, I've even seen some little poodle that had patellas popping out on both sides. They actually walked in kind of a hunched stance because they couldn't get their kneecaps back in to fully extend their legs the way they should. And unfortunately, it's very common. A lot of times, these have to be surgically corrected, and it's pretty involved, not only getting the kneecap back where it's supposed to be, but also adjusting certain points on the bones to keep the kneecap in line for the future. And here's our luxating patella. So this is the normal one where there's this groove right here and everything's in a straight line. Or then you get where this bone is twisted a little bit that way or a little bit to that side, and then rather than being in this groove where it's supposed to be, it pops out to the side. So this is the groove where it should be. And over time, the more it pops in and out, this will wear down and become flat. And that's one of the things you have to fix surgically to prevent the kneecap from popping in and out. So, also we have cruciate ligament tears, which are decently common in basketball players and any dog willing to jump up and down for any reason. With that, because of the way a dog's knee is designed, it sits on a point like this. So every time, once that ligament is torn, every time they step, that tibia bone is pushing forward, and the knee's sliding down the hill. This is kind of how I refer to it. So every time it does that, it rubs the cartilage off on the bones there because it's not stable. It's jiggling around, moving around. So this is the ligament here, and this is what it looks like when it's torn. And it's a tiny little ligament, but it's responsible for holding that knee very, very stable in order to prevent everything from jiggling around. Even a partial tear of it, so it has two bands where if you only tear half of it, you still get enough wiggle room in there to cause the cartilage damage in the knee. Okay, so spondylosis. This is a fancy word to describe arthritis of the spine. So anytime the spine is unstable, especially those little dachshunds, anybody that the bend in the back classically there, and the longer breed dogs, longer back dogs, any instability, the body tries to fix itself. So that's how we get these little humps right here. And it's the body's way of trying to prevent those vertebrae from moving around and bending too much. So spondylosis deformans is just the fancy word for that. And like I said, what it's doing is just trying to stabilize that spine to prevent things from moving around too much, causing any pain in that fashion. Okay. Cats. So cats are the great hiders of everything. Cat, because of them being, a predator and a prey animal, they still have that instinct where if they are sick, they do not tell you until it is severe. Same thing with arthritis. 33% of cats have arthritis, but 90% of cats over the age of 12 will never tell you they have it. And chances are they have it. So as cats get older, a lot of people are like, oh, it swats at me when I pet it, it's just grumpier in its old age. Chances are it has arthritis, and you petting it is painful for its spine, and that's why it's swatting at you. Don't touch that, it hurts. Those kind of things. But only 15% of them will actually appear lame, doing a limping or something like that over time. Speaking of cats, our little neighbor cat came to visit. So, rather than mostly the limping and things like that we'll see with the dogs, we find hiding or stiffness with cats. They'll start to urinate outside the litter box because it's too painful to climb over the edge to get into the litter box. They won't eat. Personality changes such as swatting at you when you're petting them. They won't turn around to groom their back end anymore because it's too painful to turn around, things like that. They used to jump up and lay in the window every day. Now they're more close to the floor, laying in front of the window rather than up on the sill, things like that. Okay. So, arthritis, it's easy, but sometimes difficult to diagnose depending on what the animal is actually presenting for. And because we have so many different types, that's what makes it kind of difficult. So, depending on what they're presenting for, you get the chemistry panel. So we check the kidneys, the liver, especially with the behavior changes, the weight loss, things like that. They're not moving around. Make sure there is no infection or inflammation going on with the CBC, where we check the blood and the white blood cells. In dogs specifically, checking for the tick-borne diseases, because Lyme disease can make those joints swollen. It can be painful, can lead to arthritis and things. And then there's the x-rays. Usually they're the most helpful. Taking the x-ray, you can look specifically at the bones and see if there's the extra bone spurs, the pokes, the bridging of the spine, things like that. Specific tests mostly for the rheumatoid arthritis and things like that. Taking samples directly out of the joint capsules, so testing the joint fluid itself. That's helpful in the rheumatoid arthritis and seeing if it's something infectious causing the joints to be swollen and painful. And then there's a rheumatoid factor that we can test for to see if it is the body's immune system attacking the joints themselves. Okay. So then, of course, treatment is a wide variety as well. It's what we in the industry like to call multimodal. So rather than just saying, here's your pain meds, you should be fine, they recommend weight loss if they're overweight, because that extra weight's going to be hard on the joints. So getting them skinnier will take some weight off the joints and get them moving more, which gives us the exercise that we're looking for. Moving the joints around, getting that extra squish in there will help to lubricate things, get the joints feeling better. That would be what we call the controlled exercise there. Nowadays there are specific diets for joint mobility. Most of the prescription diets you can get with a little bit of glucosamine chondroitin or something else to help add extra lubrication to the joints. There are laser therapy now, which the Elk County Clinic in Kersey has. We don't particularly have one, but I can always send you up there if you need one. Then, the pain management, the anti-inflammatories, the Rimadyl, tramadol, things of that nature. Sometimes environmental changes, so cutting a bigger hole in your litter box so it's not as much of a step to go over for the cat, or getting something, flatter for them to climb over. Taking your dog outside where there's not as many steps to go up and down, things like that. Certain cases do need surgical correction. Dr. Shari's Rottweiler actually had to have the head of his femur removed because his hip dysplasia was so bad. And because they took that out, now he functions